Welcome to this week's lecture on temperament, attachment, and the self in infant development. In this lecture, we will cover several important factors that affect the way infants develop. Temperament influences how easily infants can be soothed, how much stimulation they seek, and how caregivers adapt their parenting. Attachment ensures emotional security, which helps infants manage stress, trust others, and explore safely. And lastly, the self allows infants to assert independence, develop preferences, and build a foundation for social and emotional growth. Temperament refers to how individuals react to people and situations. It is one of the basic building blocks of emotion and personality. It can be described through various styles, including activity level, rhythmicity, adaptability, approach or withdrawal tendencies, intensity of reactions, responsiveness thresholds, quality of mood, distractibility, and attention span. Classic categorizations of temperament include three broad types: easy, difficult, and slow to warm up. Easy babies are generally cheerful, even-tempered, adaptable, and biologically regular, while difficult babies tend to be more irritable, highly active, and irregular in their rhythms. Slow to warm up babies, on the other hand, are often quieter, less active, moody, and slower to adapt to new environments or people. Expanding on these categories, Mary Rothbart proposed a model that emphasizes three dimensions: extroversion surgency, negative affectivity, and effortful control, highlighting the importance of emotion regulation and impulse management in fostering positive long-term adjustment. Importantly, infant temperament tends to be less stable than temperament in later childhood, making it more open to the influence of environmental experiences. Goodness of fit refers to how well a child's temperament aligns with the environment and caregivers, and it is a key factor in socio-emotional development. A child's temperament both shapes and is shaped by the relationship with their caregivers, as well as by the caregiver's own temperament, expectations, and parenting abilities. For instance, a fussy infant who is raised by a patient and sensitive caregiver may gradually become more adaptable, whereas behavioral difficulties later in life are more likely when a temperamentally challenging infant is paired with a caregiver whose temperament is similarly difficult. Overall, the fit between a child and their caregiving environment can have lasting impacts on their emotional and behavioral development. Cultural norms influence how temperament is expressed and perceived. For example, Japanese mothers may discourage strong emotions, while North American mothers are more stimulating. These differences affect emotional development and stress levels. Temperament varies consistently across cultures, reflecting cultural norms and expectations for emotional expression and behavior. For example, Japanese mothers often discourage strong displays of emotion, while North American mothers tend to be more active and stimulating with their infants. Many Asian cultures prioritize low arousal and emotional restraint. Interestingly, although Japanese babies are generally quiet and calm, research by Lewis et al. 1993 suggests they may experience higher levels of psychological stress compared with North American infants. These findings highlight the importance of considering temperament within its cultural context. Attachment is the lasting emotional bond between child and caregiver. It influences emotional and social development and begins with primary caregivers. Secure attachments provide a foundation for healthy relationships. From the moment a baby is born, primary caregivers, most often parents, serve as the child's first source of comfort, security, and regulation. Through repeated interactions, infants learn to trust that their needs will be met, whether for food, warmth, or emotional support. This consistent responsiveness fosters a secure attachment, where the child feels safe exploring the world, knowing they can return to a dependable caregiver for reassurance. Bowlby's ethological theory of attachment emphasizes that family experiences shape emotional development by interacting with innate tendencies to form close bonds. Originally developed by Bowlby, 1969-1988, this theory views attachment as an adaptive behavior that evolved to enhance the survival of the human species. Bowlby proposed that attachment develops through a series of phases during infancy, progressing from innate behaviors that bring caregivers into contact to a fully reciprocal attachment relationship. In the pre-attachment phase, birth to 2 months, infants instinctively elicit caregiving responses through crying, smiling, and eye contact, responding indiscriminately to any adult who reacts to their signals. During the early attachments phase, 2 to 6 to 7 months, sensitive and consistent caregiving helps infants associate specific caregivers with comfort, leading them to show preferences for familiar adults who reliably soothe them. In the attachment phase, 7 to 24 months, infants form bonds with particular caregivers, actively seeking proximity through their own motor skills, such as crawling. Finally, in the reciprocal relationships phase, 24 to 30 months and beyond, cognitive and language development enables children to interact with caregivers as partners, taking turns, initiating interactions, and understanding others' emotions and goals through strategies like social referencing. Across these stages, infants' behavior becomes increasingly organized, adaptable, and intentional, reflecting the progressive formation of a secure attachment relationship. Attachment provides infants with a secure base, a reliable source of comfort that allows them to explore their environment while knowing they can return to safety when frightened. Alongside this, infants often experience separation anxiety, a natural response to being apart from their attachment figure, characterized by distress and crying. This anxiety typically peaks between 8 and 15 months of age before gradually declining. Through these early experiences, children develop an internal working model, forming expectations about their own worthiness of love, the availability and responsiveness of their caregivers during times of distress, and how they can expect to be treated in relationships. Together, these concepts illustrate how early attachment shapes both emotional development and social expectations. The security of attachment reflects the degree to which infants trust that their caregivers can reliably meet their needs. Ainsworth developed the strange situation, a structured observational procedure designed to assess attachment security by placing infants in mildly stressful situations. Based on their behavior during this procedure, infants are classified into different attachment types. Securely attached infants use their caregiver as a secure base, exploring the environment and playing with toys while periodically checking in. In contrast, infants with insecure avoidant attachment show little interest in the caregiver and focus on exploring the room independently. Those with insecure resistant attachment exhibit a mix of clingy and resistant behaviors, while insecure disorganized attachment is characterized by inconsistent or contradictory responses to the caregiver. Together, these classifications provide insight into how early caregiver-infant interactions shape patterns of attachment and emotional regulation. A secure parent-child attachment is linked to positive socio-emotional development, whereas insecure attachment is associated with increased physiological reactivity and less adaptive responses to interpersonal stress. Importantly, attachment is not fixed. High-quality interactions with caregivers later in life can help compensate for earlier difficulties, and infants are capable of forming attachments with multiple caregivers. Consistent, sensitive caregiving is key to secure attachment. The most significant factor shaping infant attachment is the caregiver's ability to respond consistently and sensitively to the child's cues. insecure patterns often result from caregiver unavailability or conflict. The caregiving environment significantly affects attachment quality. When caregivers are emotionally unavailable or unresponsive, infants are more likely to develop an insecure, avoidant attachment pattern. Additionally, conflict among caregivers and a generally poor caregiving environment can further disrupt the development of secure attachment. Maternal depression can significantly influence the quality of attachment between mother and infant. Depressed mothers often struggle to accurately recognize their infant's needs and may be more attuned to negative emotions than positive ones when interpreting facial expressions. As a result, challenging infant behaviors are more likely to elicit negative responses. Compared to non-depressed mothers, they may show less responsiveness and affection, rely more on negative forms of touch, and display greater negativity in their emotions and behaviors. Even so, some infants are still able to form secure attachments if their basic needs are consistently met and they are supported in maintaining a regulated state. Fathers also play an important role in shaping infant attachment. While mothers are often more soothing and nurturing in their interactions, fathers tend to engage in more stimulating forms of play. When given the choice of a play partner, infants frequently show a preference for their father. Although cultural differences exist, the distinctions between maternal and paternal roles are generally not dramatic across societies. Fathers' high-intensity, playful interactions provide infants with valuable opportunities to practice regulating arousal and managing excitement. Attachment security is not a fixed trait, but a dynamic process that can change over time, depending on a child's caregiving environment and broader life circumstances. The stability of attachment influences attachment security, and secure attachment tends to remain stable with consistent care. For instance, when securely attached infants continue to receive consistent, sensitive, and responsive care, their attachment patterns are more likely to remain stable across development. However, stability can be disrupted by risk factors such as low socioeconomic status, family conflict, chronic stress, or a lack of community and social support. These stressors may strain caregivers' ability to remain consistently responsive, which in turn can alter the child's attachment security. For example, consider a child who develops a secure attachment in infancy because their caregiver responds warmly and reliably to their needs. If later on the family faces financial hardship or significant stress, the caregiver may become more distracted, emotionally unavailable, or inconsistent in their responses. Over time, this shift can undermine the child's sense of security, potentially leading to less adaptive attachment patterns. Conversely, improvements in the caregiving environment, such as increased social support or therapy for a struggling parent, can help restore sensitive caregiving and strengthen attachment security. Attachment patterns vary across cultures. Western cultures often emphasize individuality and independence, whereas Eastern cultures place greater value on collectivism and interdependence. What counts as sensitive caregiving also varies, with behaviors considered nurturing in one culture not necessarily carrying the same meaning in another. Because of these differences, the strange situation may not always provide an accurate measure of attachment security across cultural contexts. Importantly, it is not the specific attachment bond with a single caregiver that matters most, but rather the presence of consistent, reliable, and supportive relationships overall. Self-awareness is the ability to recognize and understand yourself as a distinct individual, separate from others and the environment. It involves being aware of your own thoughts, emotions, behaviors, and characteristics, as well as how these are perceived by others. Before infants can take responsibility for their own actions, they need to see themselves as physically separate from the world around them. It is difficult to tell if newborns have self-awareness because infants cannot tell us what they know. There is ongoing debate about whether self-awareness is something we are born with or something that develops over time. Some argue that self-awareness begins to emerge around 3 months of age, as infants start to build body awareness through physical interactions and contact with their caregivers. Others believe self-awareness shows up when infants realize their actions can affect the people and objects around them. As they experiment and notice these effects, babies begin to see themselves as separate from their environment and gradually develop a sense of self. Self-recognition refers to the ability to identify oneself as a distinct individual. Self-recognition develops gradually. The Rouge test and mirror recognition help assess this. The Rouge test is performed by placing a small mark on an infant's face and observing their reaction to their reflection. If the infant has an internal representation of their face and recognizes the infant in the mirror as themselves, they will notice the dab of rouge and reach for their own nose. This ability depends on cognitive development, including the capacity to form mental representations of oneself. Mirror recognition develops gradually. Infants react to their reflection around 3 months, notice coordinated movements by 8 to 9 months, and most show clear self-recognition by 18 to 24 months, touching their own face when they see the mark. Importantly, experience with mirrors is not necessary, as infants across cultures show similar developmental timelines. Self-recognition may also appear in other ways, such as recognizing oneself in photographs or using personal pronouns. Brain studies indicate that mirror self-recognition is associated with increased connectivity between regions involved in self-reflection, making it a strong indicator of a developing sense of self in early childhood. Between 18 and 30 months, toddlers' self-awareness expands beyond simple self-recognition to include a categorical self, in which they describe themselves using broad categories such as age, gender, and physical traits. For example, toddlers may say big, strong, girl/boy, or baby/big kid. This emerging categorical self begins to guide behavior, as seen when children, after labeling their gender, spend more time with toys associated with that gender, reflecting early self-directed regulation. Around the same time, toddlers' growing language skills support further self-understanding. They begin to use personal pronouns and possessive terms such as I, me, and mine, signaling a developing sense of self in relation to others. By about 21 months, toddlers' claims of possession highlight their ability to distinguish between I and other, marking an important milestone in self-definition and the early formation of self-concept. Self-control requires self-awareness. Toddlers learn to comply with requests and regulate behavior. Encouraging autonomy supports compliance and lays the foundation for future emotional and cognitive growth. In other words, developing self-control requires an awareness of oneself as distinct from others, which allows children to follow requests and adjust their behavior. Caregivers who support and encourage autonomy help children become more likely to comply with instructions. The significant socio-emotional growth that occurs during infancy provides a foundation for the physical, cognitive, and emotional developments that children experience in early childhood.